from the Department of Communication in Phillipsburg. This is 30 Minutes with Government with Cedric Peterson.
Hello, I'm Cedric Peterson of the Department of Communication, and welcome to this edition of 30 Minutes with Government. The government of St. Martin, together with the Public Prosecutor's Office, launched a program entitled Stop, Drop, and Go that is designed to tackle getting illegal weapons off of the streets of St. Martin. The Minister of Justice, the Honorable Dennis Richardson, while speaking at a press conference on Thursday, October 16th, highlighted how the program will work.
The Stop, Drop, and Go program is a way of the government of St. Martin, together with the Public Prosecutor's Office, is trying to get the illegal weapons, the illegal firearms that are on the island, get you to surrender those weapons to our government, and get as much of those weapons off the street as possible. I'm quite sure it has not gone unnoticed that in the recent past, the island has been terrorized with a number of robberies in which weapons have been used. That is a dangerous development that we cannot really allow to continue. As a result of that, the police has intensified their controls on the matter of illegal firearms owned by or used by persons here on the island. And the result of that in the past weeks is that some 26 weapons, I believe, if not more, were collected, and a great number of people have been incarcerated as a result of that. That program will continue. It will, in fact, intensify after the 3 weeks grace that is being offered in the Stop, Drop, and Go program. Stop, Drop, and Go is collect the weapon that you have, deliver it to the address that is mentioned on it, and you will not be prosecuted. If after that you are found with an illegal weapon, be prepared to be punished more severely than the period before that. That is in essence what this is about, and it is an encouragement to those who have illegal firearms to surrender those firearms to our authorities so that we can get those firearms out of the community and off of the street.
Attorney General Taco Stain highlighted the working cooperation between the French and Dutch side and the type of guns that are being looked at during this campaign.
Very glad that this action, this program is possible. We're doing it together with the French. They're doing a similar action at the same time on the French side. And our intention is to get guns off the street and with that bring down the use of guns and gun violence. We have seen an increase in the use of guns, and we want to stop that. What will happen these 2 weeks is that people can drop off their guns at my office in the Welfare Road in Simpson Bay. They will be not prosecuted for the possession of guns, but after that time, the minister already said that we will throw the book at you, so to speak. That means that you can be held in pretrial detention and you can face more severe punishment, at least from the side of the prosecutor's office. It's not only real firearms, also the so-called fake guns, not toy guns. They don't look like real guns, but the fake guns that look like real guns that need to be taken off the street too. Because if someone faces you with a gun, you're not going to argue whether or not it's fake or real. You are being threatened at that point in time. This is really a golden opportunity. We just went through Gonzalo, and that means people are cleaning up the yard, cleaning up their houses, and that gives you the opportunity to start cleaning up, really doing that by also bringing the guns you have in your house.
Acting Chief Commissioner Carl John says that the police will be tackling this campaign with a two-pronged approach, both preventative and information gathering, as it relates to how weapons are making their way into our communities.
The police is definitely a partner in this project. Our approach to the project is two-pronged. For now, we are seeing this as preventive. There's, for people to get a chance to deliver their weapons. As far as the preventive part, we will be going to schools, we will be talking to the youth, we will be going to the blocks. Our community police officers will be out there in a preventive manner, to speak to the community about how important it is to have their weapons delivered. Next to that, our information desk, our Criminal Intelligence Bureau is busy gathering all information. And in cooperation with our counterparts on the French side, after this effort, where everybody get a chance to turn in their weapons, after this effort, the police counterparts will be dedicating a lot of their investigative power to find the lines of weapons that comes into the community, and also to act upon all information we have with regards to weapons within the community. The police will invest all of its power to have St. Martin rid of weapons. So we want to caution the community and also ask them, make good use of this chance, put the weapons down, and let's make St. Martin safe for one another.
Postal Services NV has opened a new office at the harbor in Point Blanche on Friday, October 17th. Interim Director of Postal Services NV, Ms. Antonia Wilson, addressed the invited audience and announced the launch of the new service of personalized stamps.
On behalf of PSS and its entire staff, I would like to thank you all for being here today as we continue to push the boundaries of postal services and what it means to be a modern postal service provider. Today, we officially open a location that will introduce a new product to our island of St. Martin, while increasing the accessibility of already existing services to islanders and visiting guests alike. This new product is personalized stamps. Personalized stamps is a service that's offered by PSS that allows customers to create their own memorable experiences of their visit to St. Martin on a stamp, which can be shared with friends and relative ones. The personalized stamp service is being launched today at Dr. A.C. Watty Cruise and Cargo Facility, with more locations to follow. Harbor Postal location will be also providing postal services and non-postal services such as DHL. Part of our growth strategy is to actively pursue strategic partnership with companies that share our common goal. So you can look forward to receiving a call from us in the near future. Once again, I would like to congratulate management, staff, and the community in general with this great achievement.
Chairman of the Supervisory Board, Mr. Stuart Johnson, brought words of congratulations on behalf of the Supervisory Board.
On behalf of the Supervisory Board of Directors, it is a milestone worth recognizing this afternoon. Congratulations to the management of PSS, the staff of PSS, the Harbor Group of Companies, and the people of St. Martin for this milestone. This afternoon, we'll be opening the third branch for Postal Services St. Martin. Again, the testimony to St. Martin's economic development and the tourism sector that we have on St. Martin, adding services to the already existing services at the Harbor Group of Companies in a time like our good friend Gonzalo's passing right now, few days after such devastation has taken place in our country. Again, reinforces our commitment to our country and its future, that we believe in St. Martin and that together we will come back stronger than ever. This afternoon's milestone is one that will go down in the record books because St. Martin's Postal Services, a company that now belongs to St. Martin, is again making a giant leap forward, a leap that will show that not only has Postal Services grown, but it's shown that its name and its product will continue to grow. District by district, main port of entry by main port of entry. And this is just the beginning. Our resilience as a people and as a country shown today will be one that will be long remembered. We congratulate, on behalf of the Supervisory Board of Directors, every single person on St. Martin, especially the management, headed by Ms. Wilson and her support staff, as well as all of the people of St. Martin that have shown their loyalty to Postal Services St. Martin, the hard-working team that went in to organize this event this afternoon that showed no better colors than the red, white, and blue to signify the nationalistic pride that we have for country, as this post office belongs to St. Martin. The pelican soaring right above our heads in the logo of Postal Services St. Martin is again testimony that this is your company, St. Martin, and that we can be very proud of this accomplishment this afternoon. Congratulations to the people of St. Martin, and long live Postal Services St. Martin.
CEO of the Harbor Group of Companies, Mr. Mark Umingo, highlighted the working relationship between the Harbor and Postal Services NV.
First of all, I'd like to congratulate Postal Services on a milestone. I'm a bit disappointed that this is a third location. Maybe it should have been the first location, but nevertheless, we will make sure from the port side that the partnership with Postal Services will continue. Again, we are also in a traditional business, and end of the day, our success is about innovation. We will continue to support Postal Services and make sure that our guests have the right service. Not only, I was also very much impressed not only about a traditional stamp, but it's actually also personalized stamp. And if you look at also the development what's going on, everybody's a bit sick and tired of maybe going on the social media or getting an email. But again, it's also nice to go back to maybe a card with a personalized stamp. And I do believe that you all have everything in stock to make sure that the services at the port will be a success. Again, I don't want to say too much. I think it's your day, and I think this is a milestone to have these services at the port. Congratulations again on behalf of the port.
Stay tuned. You're watching 30 Minutes with Government.
I was deceived about the nature of my job. I was threatened with violence. I worked excessive days and hours, and money was withheld from me. My boss has no respect for the labor laws. All my documents were confiscated as I was confined and isolated. Now that you know, what will you do?
You can help by calling Immigration and Border Protection at 543-0355 or send email to nachicotip@gmail.com. Human trafficking and exploitation, please report it.
We're not just another Caribbean airport. We're an international gateway, designed with you, the traveler, in mind. SXM provides a state-of-the-art international travel experience, where ease and convenience is second only to safety and efficiency. At SXM, we're taking travel and tourism to new heights. Here we boast spacious check-in areas, 10 passport control points, comfortable departure lounges, and an exciting new airport mall. Finally, there's an airport in the Caribbean that takes your travel plans as seriously as you do. Princess Juliana International Airport.
Minister of Health Cornelius de Wever says St. Martin is proactive in its Ebola preparedness. This was announced at a press conference held on Monday, October 13th. The minister said an intervention management team is already in place to handle any situation relating to the Ebola virus.
Today is a date for us to just give an update and an overview of the Ebola virus and the very low risk that it poses to us at this moment. But however, we have been very proactive in addressing this. We already have the intervention management team that has been set up to deal with the Ebola virus disease. We have had a couple of press releases out there as well. The legislation regarding international health regulations that determines how we handle these situations has already been passed through the Council of Ministers, is at the Council of Advice, and then to be handled in Parliament. These are just some minor background and information, but more importantly, the question is how do we move forward? And Dr. Hassan just came back from the Pan American Health Organization meeting in Washington, D.C., which I was supposed to attend, but due to The latest developments, I postponed it, but Dr. Hassan is here to definitely give us the latest updates as far as what else we've been doing and what else needs to get done. We are also in contact with the French side. Of course, as we progress, that also has to be stepped up and make sure that we're all on the same page. You know, we already have protocols in place as far as, for example, with the chikungunya. So using this platform for the Ebola virus would be the same way. We also have contact with the Pan American Health Organization, the World Health Organization, EDIVM from Holland, and CARPHA, as well as CDC. So these organizations, of course, are there to support us and then support any country that is busy dealing with this challenge. And last but not least, I want to thank everyone for being very proactive in addressing this issue. We have not winked an eye on this one from the very beginning. As soon as it came up, the incidents management team was put in place. Meetings were held with the GPs for about suspicious cases and what needs to be done. The department also has a pamphlet with information about the Ebola virus and how to prevent it as well, and what symptoms to look for. So I want to let the public know and rest assured that we are being way proactive, and we will continue to do so. And, you know, whether we think it's far, whether we think it's near, we still have to be prepared, and that's what we will continue to do. Any additional protective gear that needs to be ordered will be ordered. We already have a lot of protective gear that came in, so we're going to be using those should the need arise. But if we need any other special protective gear, we will also be ordering those as soon as possible.
Head of Collective Preventive Services, Dr. Virginia Asen of the Ministry of Health, who attended the Pan American Health Organization meeting that was held in Washington, says that St. Martin is very much up to date with its preparedness and awareness program, which kicked off on September 30th, 2014.
As the Minister said today, we want to inform you about the status of our preparedness, and if there are any questions you also would want to know on what transpired in Washington, I will be happy to answer the questions. With regards to our Ebola preparedness, as we said in an earlier press briefing, the 31st, we started all the activities regarding our preparedness, and I can say that up to now, we are still up to date, and I have to stress, same thing as Minister already mentioned, chances are very small for us to have a case here on St. Martin, but also what was stressed again and again in Washington also when we had a special lunch meeting on Ebola preparedness was also that although the chances are very small, preparedness has to be in place for everybody who is in the chain of response with regards to Ebola.
Glenda Severin, infection control specialist of the St. Martin Medical Center, says that an Ebola preparedness plan is in place to provide healthcare workers with a plan to treat patients with the virus.
When we were invited by the Public Health Department to a meeting, all stakeholders of St. Martin, to formulate a plan, I realized how important and how serious this plan was. So immediately I got on board and I advised our director to form an Ebola preparedness team. And the team would be in charge of preparing the hospital for, in case we do get an Ebola patient. At that time, it seemed so far away, it seemed it would be in West Africa. But our ports are open, we are a tourist island, and we know that once it started to get out of Africa, it would sooner or later reach St. Martin. For this, we do not want to even think about, but however, the reality is there. We prepared an Ebola plan, preparedness plan, and one of the purposes of the plan was to provide healthcare workers with the necessary information so that they can safely care for the patient with EVD, and we wanted to respond collectively and uniformly in a manner so that infection control measures could be implemented. I need to thank our director, Mr. Kees Klarenbeek, for being on board with me. Immediately, we went into ordering our gear, and I must say at this moment, our gear, most of our personal protective equipment has begun to arrive. We have gone into full-scale education. We have educated every department in our hospital as to what EVD is all about. And presently, I am training every staff who has immediate contact with the patient in how to put on and remove their protective personal equipment. We know that the chances of contracting EVD lies with a glitch, let us put it that way, in removal of the PPE. And we have seen where our colleagues in Spain and in America have became infected. We do not want that for our colleagues. And I personally, as an infection control practitioner, has taken it personally. And I am spending as much time and as much effort as I personally can to train our workers to ensure that they know how to remove. It's a technique. And the price is too high if you fail to remove your gear properly. The possibility arises where we may have two types of admissions, those coming from the family practitioner and those coming from the triage room. We have already brainstormed, we have already put in place measures whereby persons coming from the family nurse practitioner will not use our emergency room entrance, but will be brought in through our side door, our side entrance, and directly into our emergency room. Right now, we are planning, and our emergency room department are right now looking at their triage procedure and how they can protect the people who are in the emergency room, waiting area, and the staff. So far, we have put in place questions that will specifically pinpoint people, visitors to our shows or people coming to our department, ER department, to see whether you have EVD or whether you have risk of having EVD. So these questions are in place, and we are working on a plan. If somebody answers yes to one of these questions, what are we going to do? So right now we are working on that and brainstorming and putting things in place. That person will be brought directly to our room 30, our isolation room. We have also formulated a protocol, which is a working procedure for our staff. We are using the guidelines from the World Health Organization to protect our staff. So in case a patient shows up today, I can say that we do have a working procedure which, if followed properly, should reduce the chances of any of our workers getting EVD. We also have a plan if one of our healthcare workers should contract EVD, probably by a needle stick accident. This person would become a high-risk contact, and we are planning that this nurse, we really do not want that to happen, will be placed immediately in isolation. We are also looking at our biohazardous waste. How are we going to get rid of our biohazardous waste? This protocol is right now under review, and this needs further planning right now as we speak by the SMMC and hopefully the government. We really need to look at what we are going to do with our biohazardous waste, because everything coming from the room of that EVD patient is biohazardous, and it must be disposed of properly. We are also looking at how we are going to get this patient a little bit more comfortable in our isolation room. We do know the effects of what isolation, the psychological effect of isolation on a patient, and we are looking at how are we going to get this patient who will not be allowed visitors, except for patients or parents of small children. How are we going to get this patient a little bit more comfortable? And we are looking at ways of improving our internet speed and some other means of communication with that patient, with his relatives. So we need to look at that. One of the things we are also looking at, which is very, very important, is our environmental cleaning. We also have a plan for that, and our environmental service staff, They are right now being trained. So we have left no stones unturned. We are trying, and I know that in reading the protocols, because I read every day, everything I get, updates from CDC, updates from the World Health Organization, because this is our only hospital. We need to protect St. Martin, we need to protect our workers. So I am not leaving any stone unturned, and then we will be reaching out to our government, and I know that they are taking it seriously. That's why we are here, to further improve our plan for SMMC and St. Martin.
Stay tuned. You're watching 30 Minutes with Government.
I was deceived about the nature of my job. I was threatened with violence. I worked excessive days and hours, and money was withheld from me. My boss has no respect for the labor laws. All my documents were confiscated as I was confined and isolated. Now that you know, what will you do?
You can help by calling Immigration and Border Protection at 543-0355 or send email to nachicotip@gmail.com. Human trafficking and exploitation, please report it.
We're not just another Caribbean airport. We're an international gateway, designed with you, the traveler, in mind. SXM provides a state-of-the-art international travel experience, where ease and convenience is second only to safety and efficiency. At SXM, we're taking travel and tourism to new heights. Here we boast spacious check-in areas, 10 passport control points, comfortable departure lounges, and an exciting new airport mall. Finally, there's an airport in the Caribbean that takes your travel plans as seriously as you do. Princess Juliana International Airport.
That brings us to the end of this edition of 30 Minutes with Government. For video on demand and full coverage of these stories and more, visit the official government website, www.stmartingov.org. On behalf of all of us here at the Department of Communication and the Government of St. Martin, I'm Cedric Peterson. Thanks for watching.